Good morning. This is Stephanie Servey, and I am very much looking forward to our Medicare relaunch program. Just to give you a little heads up from the beginning, perhaps some of you are wondering why we're relaunching the Medicare program and what does that really mean? Well, a few of us here at corporate have been listening to you, the franchisees. You guys have been asking a number of questions about Medicare, some basic, some not, and we felt that it was very important to give the company a strong review of the therapeutic shoe bill program, something that's recorded, can be archived, kept for everyone to hear, giving the group the same knowledge base from where to start. This is going to be a high-level overview. The entire medical team, and I'll go through who those people are, the entire medical team has assisted in putting this presentation together, though everyone else was not able to make it today, so I'm the one giving the presentation. Also, if you have questions during the presentation, if you don't mind typing it into chat for me, because that way I can keep record of the questions, and because I'd like to send out a Q&A afterwards just for everyone who was able to attend and who was not able to attend, so they can see the Q&A. And some of them I might have to do some research for you. Also, I'd like you to keep in mind that as we go along, you might find some information that I'm giving you. You would want it to be more specific, or you would want some more drill-down sessions, how-to steps. So I'd like you to make notes on that and then shoot me an email after class letting me know what other types of sessions or classes you would like for me to hold. So that way we can do that with you directly or with a small group of franchisees who are interested in the same type of thing that you are. Okay, the agenda today, what we're going to be discussing in the Part 1 Medicare series, we're going to be discussing Medicare program overall from corporate. How does that look? Supplier standards, the therapeutic shoe bill program. Part of that is the in-person fitting and delivery guidelines. Also, the coding guidelines for coverage, PDAC reviewed products. Building a compliant client medical file, as well as understanding your documentation checklist. Okay, so to dive right in, our Foot Solutions corporate medical team is as follows. It's Dr. Bill, Betty, Sherry, and myself. As you can see, we have each of us have our own type of responsibilities within the company. If you have questions about anything in particular, you might want to go to this list and see who to contact. Dr. Bill, clinical. If you are receiving medical records, for example, from your physicians now that you're requesting, and you can't quite tell if they meet the requirements for your prepayment review or post-payment audit, etc., reach out to Dr. Bill. Have him review the medical notes with you to make sure that you guys are on, they are mirroring your statement of certifying physician. Betty Hubauer, accreditation, surety bonds. She's here to help you to reduce cost if she can. She has quite a bit of contacts in that arena. Sherry is your primary support for franchisees. She is really the go-between for medical between the franchisees and corporate. And myself, what I focus on is not only the compliance aspect, which is really understanding the policy articles, the LCDs, but also billing, coding, and working on insurance contracts for you guys, and I am diligently doing now. Okay. Oh, and before I forget, if you were able to print off on Wednesday, if you were able to print off all of the information that was sent out to you for your notebook, great. If not, don't worry. We'll be going through a lot of that today, so that way you'll be able to either go through it with us step by step or either print it off afterwards. And I will have for you on the Infonet after my second class, I will have for you all the editable documents, so that way you guys are able to, okay, I'm sorry, someone else just told me they couldn't hear me. So that way you guys are able to actually hear, you're able to actually download the editable documents and use them for yourself. All right. Diving right in, since we're looking at this from a national level, I thought it would be interesting for everyone to see the United States on a whole and the 4 jurisdictions that the Medicare contractors cover for CMS. And as you know, CMS is the Center for Medicare and Medicaid Services. And they have instituted 4 contractors who carry out their policy articles and LCDs for them, and takes in the claims and pays them out. In Jurisdiction A, and you know who you are contracted with NHIC, Jurisdiction B, NGS, Jurisdiction C, Cigna or CGS, and Jurisdiction D, Meridian. For those in Jurisdiction C, I understand that Blue Cross and Blue Shield of South Carolina has recently purchased them. So at the end of April of this month, actually, I can't believe we're already April 1st. So at the end of this month, we are going to be transferring from Cigna to Blue Cross Blue Shield of South Carolina. I am assured by my internal contacts that it is going to be a seamless transition. All the same teams will be in place, even the same phone numbers. So there should not be an issue at all. If there are any changes whatsoever, and actually the only ones will be the logo will change, and of course Cigna, the name Cigna will be removed. I will alert you to that. Also, it's important to understand that knowing if you have any snowbirds that come to your area or visiting parents that use service in your store, you want to know which jurisdiction they're from. So that way when you're billing, you know which jurisdiction to send your claim. The way you know that is take a look at their driver's license and see where their primary permanent address is. And that is how you know which state to bill. Next, I just put a simple listing out for you of the DBMAC contact information. You have that in your packet. Also, we have Medicare deemed accreditation organizations. This is just so you can see that there are many more than just the ABC and BOC, as you might be aware of, that Medicare has deemed a good accreditation organization. And of course, Betty's here to help you when you guys need to renew, or if you are new to Medicare and are thinking about joining, you would contact her to become accredited. Surety bonds. I've listed here a couple of things, and within your packets that I sent out on Wednesday as well, the Bureau of United States Department of Treasury has listed out hundreds of recommended and approved insurance providers for you to pick from and to use. Also, I've also included a great Q&A that I found on CMS's website. It is the final rule, even though it is, I think, a 2006 or 2009 Q&A journal information, questions and answers. It is the most recent and most up-to-date. But I thought it was chock full of great info for you. Also, I added a page in there about pedorthic liability coverage because this actually very recently came to light. Recently discovered actually through another franchisee who found out through their liability rep that their liability coverage did not cover their profession, pedorthics. So you want to make sure, and just as an FYI for you guys, make sure you go back through your liability coverage and it specifically states that it covers your profession and it has pedorthic liability coverage. I'm told that if it doesn't say so, it is not covered. If you're unclear, I would definitely go to your rep and ask them to walk through with it with you. Okay, the CEDI. For those of you who, I don't know, there are some out there who are using third-party billers, and there are also some of you out there who are billing yourself Medicare. Those of you who have been thinking about billing for yourself, I find that, and I use PCA's Pro 32 when billing Wendy Hill Medicare claims. This is a free billing software that is quite easy to implement. The enrolling process is the one that takes actually the longest. Then once you have the billing software downloaded, you just find the clearinghouse, and I've given you a list of all the approved Medicare clearinghouses for you to use that you can pick from, and they range from very expensive to not expensive. And basically all it takes is practice to be able to use the software. There's a 1-800 number, a ready customer service that is able to answer your questions. You download your packet. I found it very simple, or relatively simple. So I also had some franchisees ask me, well, I prefer actually to bill hard copy. It's much easier for me. Why would I even bother with the electronic portion of it? I don't even want to deal with that learning curve. Well, first of all, electronically billing. I mentioned snowbirds earlier. When you electronically bill through your PCA's Pro 32, all you have to know is that that person is from another jurisdiction. You put that into your software, into your claim, and it will automatically shoot it to the appropriate jurisdiction for payment. Your claim is immediately reviewed and determined by the software if it's a clean claim. This is priceless because, of course, when you're filling out a hard copy, the hard copy doesn't tell you if it's not a clean claim, if something's missing or lacking. But from the software, it does, and I love that. Also, something that's very important, when you send out your batch of claims, you will receive about 7 to 10 days later, or sometimes a little earlier, I found, an electronic remittance advice, or EOB, from Medicare. So you know what you're being paid and what you're not being paid, what you need to appeal, and so on. Also, you have the option to have an automatic deposit if you'd like. And so when you receive that remittance advice, you receive your automatic deposit. Okay, let's shoot on into DME POS supplier standards. I had the opportunity to attend a Medicare conference last week in Charlotte, North Carolina. And I met with Erica Williams, who's the National Supplier Clearinghouse Ombudsman. And so she took the time to really go over the additions and revisions of the supplier standards, as well as something we're going to talk about at the end of the presentation, a new effective CMS update. And I felt it was important just to go over this with you guys. Standard 1, I list out the ones that have been revised or updated here within the supplier standards. And if you guys haven't read them in a while, go back and do so, because this should be your Bible in a sense, that you really want to make sure that you're measuring yourself by. And when you have an on-site audit from CMS or review from your accreditation company, they're going to be using the supplier standards. So number 1, a supplier, I'm just going to read through them. A supplier, must be in compliance with all applicable federal and state licensure and regulatory requirements and cannot contract with an individual or entity to provide licensed services. This particular supplier standard, the suppliers must comply no later than September 27, 2013 with this standard. Number 2, standard 2. Requires a supplier must provide complete and accurate information on the DME POS supplier app. Any changes to this information must be reported to the National Supplier Clearinghouse within 30 days. So for whatever reason, you are moving your store location, you are changing ownership, you have decided that you are leaving the business, you need to make sure that you contact the National Clearinghouse within 30 days of with this information. Number 7, revision of Standard 7. Supplier must maintain a physical facility on an appropriate site. This standard requires that the location is accessible to the public and staff during posted hours of business. The location must be at least 200 square feet and contain space for storing records. This is an interesting one because, for those of you who are interested potentially in having a mobile van and taking that out. I know we've had a couple of franchisees who've been interested in moving the store to something like this. This is a very important standard. The standard also becomes effective and all the suppliers must comply with absolutely no later than September 27, 2013. It is, if you decide to do something like this, and your office is in a restricted access area, that is fine, I'm told by Erica, the ombudsman, because I think this was a concern from some franchisees, that the only thing is that it must be easily accessible. Even if a guard is at the gate, it should be able to come through. Also, posting a sign for posting your hours of business must be clearly visible. All right, number 9. A supplier must maintain a primary business telephone listed under the name of the business in a local directory or toll-free number available through directory assistance. The exclusive use of a beeper, answering machine, answering service, or cell phone during posted business hours is prohibited. I think that's a clear one. So just make sure that you have a primary business telephone, as I think most of us do. Jumping on down to Standard 28. Let's see here. Oh, excuse me. Standard 11. I missed that one. Clarifies the requirement. Sure. I'm sorry. Someone's asking to turn up the volume. Let me know if that works. If you guys can hear me, I'll pull it right next to my face. You can hear me. Okay. Standard 11 clarifies the requirements about direct solicitation of beneficiaries. Basically, a supplier must agree not to initiate telephone contact with beneficiaries. The standard prohibits suppliers from contacting Medicare beneficiary based on the physician's oral order, unless the exception applies. So obviously, we are to get written orders for our shoes. So as long as we get the written order, they become our Medicare beneficiary, we can initiate telephone contact with them, following up, for example, with them the following year, letting them know to come in for their shoes. This is just a heads up. Supplier standard number 28, a supplier must maintain ordering and referring documentation consistent with the provisions found in 42 CFR 424-516. This just means that all your documentation must be maintained for 7 years. We recently had a franchisee who closed their doors and then decided to shred all of their Medicare documents. Unfortunately, she didn't ask before doing that. That's frightening to me because if there's ever a post-payment audit and they can go back a maximum of 3 years from the date of service paid, then she is without documentation or proof of any sort and will have to reimburse Medicare. So we always remember, maintain those documents for 7 years. Supplier standards number 29. This prohibits, DME POS suppliers are prohibited from sharing a practice location with certain other Medicare providers and suppliers. So basically, as said, you have to make sure that you are not sharing a space with them. And as long as, Erica states that as long as the U.S. Postal Service recognizes if you're in one suite and they're in another suite but in the same office building, then that is fine. But sharing the same suite and confusing the Medicare beneficiary, thinking that they're going to the same place, is not. Number 30, DME POS suppliers must remain open to the public for a minimum of 30 hours per week with certain exceptions. I think for a lot of us who have the stores, that's a simple one to take care of. You just want to make sure that you are open to the public, your doors are open for 30 hours a week. All right, let's speed on along. Next slide. I thought it was important just to have this slide for everyone's edification here. Basically, listing out our state licensure states. If you are in one, I'm sure you know that you are. Here's the pending ones to the left. Kentucky is actually becoming a licensure state effective 2013. This is important because if you aren't a licensure state or if you are thinking of joining Medicare, you need to not only know and follow your policy articles and limited coverage determinations, but you must also know your O&P licensure. Sometimes it impacts podorthists, sometimes not. But nonetheless, you need to really know your laws, because in some cases, the state laws are more stringent than Medicare's general rules. So you want to make sure that you are covering that and keeping up to date. If your state is in the pending, on the pending side, the left-hand side, or not yet, make sure that when you receive letters from your accreditation company, that you're opening them up, you're reading them. They will notify you if there is pending legislation within your own state about this. I know that we had a franchisee found out exactly that about Kentucky for us because they received a letter from ABC. All right, moving along. Tab 3 within the documents that I gave you on Wednesday. I don't know if you guys have ever taken the time, I'm sure you have, to take a look at your policy articles and limited coverage determinations and to see really how they're separated out. I found it interesting in a weird sort of way, a nerdy sort of way. But some history to that. All the local policies, there are 4 different DMEMAC medical directories, one for each jurisdiction, and they all get together in a room and they jointly develop these policies. And they're all identical for all 4 jurisdictions. So the 3 sections are as follows: non-medical necessity coverage and payment rules, coding guidelines, revision history. And the first one really identifies when something is statutorily excluded by law. So that way you're really clear on it. The coding guidelines talks about related coverage issues, also lists out all the ICD-9s that are covered. And so there is a revision history, and these PAs, policy articles, are released quarterly. So be on the lookout for those. If you aren't receiving updates from your jurisdiction daily or weekly, make sure you get on and do that. Very helpful. LCDs. These are closely related to policy articles, and they have various components within them as well. Indications and limitations of coverage, medical necessity. This really defines clearly, or somewhat clearly, the coverage criteria. The HCPCS codes and modifiers section all list the codes that are applicable to the services that you're giving or items. Third section, ICD-9 codes that support the medical necessity. I think it's important to state here, even if the codes are listed within the LCD, it doesn't necessarily mean that it's a covered code. They also have a section called documentation requirements, which all of us have been really poring over very closely, making sure that we have everything we need for our pre-payment audits and post-payment audits. And then, of course, there's a revision history. Okay, so now that we've just breezed through the overview of that, I hope you downloaded your own LCDs and policy articles and you have them in your file so that you can review them at any time. But I want to go ahead and take a look very closely at this. And keep in mind, too, I have made an effort to go over all 4 LCDs and PAs, making sure that the information I give you applies to you, no matter what jurisdiction you're in. So what we're hearing today applies to everyone. Physician supplier requirements. Okay, what is a prescribing physician? A prescribing physician writes the order. So the written order that you're receiving is from a prescribing physician for the therapeutic shoes, modifications, and or inserts. There can be an MD, a DO, a DPM, a physician assistant, a nurse practitioner, or a clinical nurse specialist. It's very important that they're knowledgeable about diabetic footwear, those that write out the written orders. Just a little sidebar comment here. The nurse practitioner must actually have their own NPI number. They cannot be working underneath a physician and use their NPI number. If you've ever come across anything like that, you want to make sure you send that written order back and you have the doctor sign the written order, not the nurse practitioner, because it will not be used in this case. This is what was clearly said to me by CMS. What is a certifying physician? A certifying physician provides the medical care for for the patient and manages their diabetic condition. This is the physician that you receive the statement of certifying physician statement from, or the SCP. This person must be an MD or DO only. And then you can read that second bullet, which really doesn't apply to us. The third component is a supplier. Who's a supplier? We are obviously a supplier. There are others that can be as well. So we furnish the footwear to our patients or clients, and we are the ones who bill Medicare. Therefore, since we're the ones who are billing Medicare, the onus falls on us to collect the documentation and to supply documentation to Medicare in supporting the supply of footwear. All right, looking at the coverage criteria. Our therapeutic footwear, shoes, inserts, and mods may be covered if the following 6 points of the criteria are met. 1, your beneficiary must have diabetes. 2, the certifying physician has documented one or more of the following points or conditions on the SCP, as well as in their medical record. Keep in mind that the SCP that you receive, that initial paper that you're receiving from your certifying physician, it must mirror the patient's medical record. 3, the certifying physician has certified the indications 1 and 2 that we just went over are met, and that they are treating the patient under a comprehensive plan of care for diabetes. And this is clearly shown within the medical notes. Again, I can't stress that part enough. Number 4, also the need for therapeutic shoes and inserts is clearly stated within the medical notes as well. Okay, the section in blue underneath, I'm going to read through and then I want to go over a bit because I want to make sure we're all super clear about these time frames. And these are very important for everyone to keep in mind. For any claims that you receive with dates of service, meaning the date of dispensement, on or after January 1, 2011, the certifying physician must have an in-person visit with their patient during which diabetes management is addressed. This in-person visit must be within 6 months prior to the delivery of the items dispensed, so prior to the time you have dispensed the footwear to your client. Also, then in turn, they must sign the certifying statement on or after their evaluation, that specific evaluation, and within 3 months prior to you delivering the footwear. Okay? So for example, let's think about this and come up with an example for us. March 1, you have a client who walks in and says he wants a pair of shoes. He's a diabetic. He has all of his paperwork in order. He saw his physician on January 15th, 2011. He did an entire evaluation. It is January. It's about 2 months prior to seeing you, or a month and a half prior to seeing you. You want to make sure that that SCP doesn't have to be signed on January 15th. It can be, but it must be signed within the time prior to seeing you and since the January 15th date of service. Also to know the written order, because it doesn't have to be signed by the same certifying physician. It is a lot of the time, but it doesn't have to be. That written order is good for 12 months. So the written order is good for 12 months. The statement of certifying physician is good for 3 months. And the in-person visit evaluation is good for 6 months. BF sent me a chat question. If you could go ahead and expand on that, that way I can understand and respond to that better. Okay, continuing on with coverage criteria. Number 5 of the 6 I was mentioning earlier. This is what we can control, the supplier. So prior to selecting footwear, conduct an in-person evaluation. You need to make sure that you are documenting, because CMS Medicare states that if it is not documented, and this goes for physicians and you guys as well, if it's not documented, it never happened. It doesn't matter how much you did it or how descriptive you were in your own work, but if you did not document it within your patient's file, it never happened. And that's an auditor's outlook, unfortunately. So, first bullet point: an examination of the patient's feet with a description. So you must document very clearly an examination of the patient's feet with a description of the abnormalities that will need to be accommodated by the shoes, inserts, and modifications. 2, measurements of the feet. 3, and then for custom shoes, make sure that you are writing out the impressions that you've received from making the casts, obtaining images, or however you've done that. And then when we get into documentation section, we'll go through. I've given you guys some really great documents on being able to make sure that you are documenting accurately and clearly for any type of review or audit that you receive. Number 6. Okay, so at the time of delivery, sometimes this happens on the same day, sometimes it doesn't. If it does not, make sure you clearly document the date of service that you are dispensing those shoes, because the date of dispensement, of course, is the date of service billed on your claim. So when you are documenting for that in-person visit for delivery, the evaluation must be conducted with the patient wearing their shoes and inserts. And you must document that they fit properly or not. I mean, it depends on, of course, what you see. But a lot of the time, I know I had one franchisee tell me was very frustrated because they did not document clearly that they actually watched them walk in their shoes and inserts, even though they do that every single time. But since it wasn't documented, they didn't pass the review, and so they didn't get paid. All right, program coverage and benefit summary. Let's get to the products that we dispense. So those Medicare beneficiaries that meet the criteria that we've just discussed initially with the certifying physician and the prescribing physician, this coverage is limited to only 1 per calendar year, meaning January through December. There are 3 components to it. You can give them, depending on the written order, because we know that the written order must clearly delineate the items that the physician is prescribing. So no more can it say, review and determine, or diabetic footwear, or something general like that. It must state diabetic shoes and custom inserts, or diabetic shoes and over-the-counter inserts, or however, multiple density inserts. So, and then if they need a modification, if the shoes need a modification, it must state so on the written order. So 1 pair of off-the-shelf stepped shoes can be prescribed, along with 3 pairs of multiple density inserts. This can be custom or not. Number 2, 1 pair of off-the-shelf depth shoes, or custom molded shoes, including a modification. So if there's a modification given here, then only 2 pairs of inserts can be included within this grouping and supplied and covered. 3, 1 pair of custom molded shoes, including inserts, and 2 pairs of multiple density inserts. So obviously we know that when we supply custom molded shoes, they're only covered for those patients that have a foot deformity and can't be accommodated by any off-the-shelf shoe. And obviously that we're documenting that very clearly within our notes. All right, additional points to keep in mind. Just want to bring some things to the surface here that we might not have seen or might have come across our desk. However, separate inserts may be covered and dispensed independently of diabetic shoes. This is fine. Supplier just needs to make sure, you guys need to make sure that you document very clearly, if you are only supplying the inserts, that the patient, you must document really clear in the patient file that they already have the appropriate diabetic shoes in place. You have seen them. You've put the diabetic inserts in them. You know that they are just fine for them. Number two, the Therapeutic Shoe Bill Program reimbursement, and this is just because, and I wanted to list this out really clearly, that when we charge for the items, the shoes and the inserts, all of that includes the foot evaluation that you give, as well as the fitting, as well as any follow-up sessions. Because I've had franchisees ask me if we can bill for an evaluation and management code for that, and we cannot. That is only a physician that may do that. All right, obviously the benefit period is per calendar year. We know that. We know the reimbursement allowable by CMS is 80% of the total allowed, and the copay that you must collect is 20% if they don't have a secondary. I've heard from other franchisees in the western states that they have a hard time collecting that copay because other competitors don't. This is considered an abuse by CMS, and really they could take issue with you on this. It is very important to follow the guidelines and to collect the copay. All right, and obviously only non-assigned suppliers. So if you are a non-assigned supplier, you may collect total charges up front. I felt this was just important just to have on a slide so we're really super clear in regards to orthopedic footwear. If you're unclear, go back to the application, the 855S that you submitted to the National Clearinghouse when you wanted to become a Medicare provider, and look at the boxes that you checked. You probably only checked diabetes. So even if that isn't the case, it's really important to note that certified podorthists are not considered qualified under their scope of practice as defined by the ABC to provide the covered leg braces under this coverage. Therefore, certified podorthists are not qualified to bill the L-code products. Okay? The A codes that we're going to be talking about a little bit more in a second, that we're billing Medicare, if you look in your HCPCS book or however, and we're going to talk about exactly how they are defined by HCPCS, they always say diabetic. So the A codes are for diabetes diagnosed clients only. So I want to put that up front. If you have any questions, just go ahead and type them up for me and I'll be happy to answer. All right, coding guidelines. Let's talk about billing Medicare. And we'll just briefly cover this. And if you guys, like I said earlier, if you guys want to really go through a more in-depth look at billing Medicare and all the ins and outs of modifiers and that sort of thing, I'm very happy to have an additional session for you. All right, A5500. As I said, I typed this up, wrote this out exactly how my HCPCS book is written so that you could clearly see it says for diabetics only. Fitting, including follow-up, custom prep, and supply off-the-shelf depth inlay shoe manufactured to accommodate multi-density inserts per shoe. So we know that when we're billing Medicare for our diabetic off-the-shelf shoes, we're billing A5500 2 times. And we make sure, look at the modifiers below, we make sure that each of these have an LT and an RT. A55 LT, meaning this left shoe, A5500, right shoe, RT. I've seen it done on 1 line, I've seen it done on 2 lines on your claim. So also you want to make sure that you're using the modifier KX. Since we are a diabetic shoe supplier, the KX modifier must be used on each billing line. The KX modifier just specifically says that you are meeting the requirements. So basically, you have all the documentation in place that meets the requirements as stated in the policy articles and the LCDs. You have met them. And then if there's ever a review or audit, you're able to supply those with absolutely no problem. Now, everything that I have read and have seen, and I haven't tried otherwise, I have to say, that you must bill with a KX modifier in each line. If you don't bill with a KX modifier in each line, then it will be denied, the line will be denied, and you will have no opportunity to appeal, which means you will never get reimbursed. Okay? And then A5501, we know that that's for diabetics only, and that's for the custom prep shoe. Okay. Moving on along, taking a look at the inserts. So I'm not going to read each of those definitions to you, but A5512, A5513, suffice it to say that when we bill that, again, that's for each insert. So if we're supplying 3 pairs of inserts, you're billing that 6 times, correct? Also, you're making sure that you're billing with the appropriate modifiers too, RT, LT, and KX, as I just mentioned a minute ago. Inserts must be PDAC reviewed. Make sure you go to this website. If you've never have before, take a look. Prior to purchasing the inserts that you are giving your patients, your clients, make sure that you're purchasing from the correct manufacturer. Make sure that you're purchasing the correct style. And keep in mind that, when you see your vendor next, if the vendor comes and visits you, ask them for that PDAC reviewed letter. They have one, and they might not have one on them, but they can certainly get that to you. And it would be great and proactive of you to keep something like that on file, because nowadays I'm seeing in the prepayment audits and post-payment, the prepayment reviews and post-payment audits, there is a particular line that they are now starting to ask for that information, for that PDAC reviewed, because they want to make sure that the inserts that you're supplying are PDAC reviewed. Okay? All right, so it's 9:15. I just want to make sure we have plenty of time. I have another 15 minutes to get through this because I want to make sure you guys have plenty of time to ask questions and answers. Okay? All right, so tab 5 within what I gave you, we'll pull that, and if you have that in front of you, make sure you have it in front of your computer so we can look at the forms together as well as going through these files. This is just a simple, and I'm sorry for the off-kilter circles, but that's the only way I could get everything to fit in. Just make sure that you follow this particular compliant client medical file. So basically, the intake form we're going to go over, we do that, and we do everything in this particular order. An AOB, after the evaluation form circle, an AOB is an authorization of benefits, for those that didn't know that. This is basically just giving you the permission to work with their doctors and receive payment from Medicare directly. Very important to have this signed off on, and I'll go into more details to why. All right. So how do you build a compliant medical file? We use the intake form. Go ahead and pull that out. I'm going to come around here. You can look at this with me, Dawson. Go ahead and pull that out, and we can all take a look at the intake form together. There is an example of an intake form on the CMS website, a suggested intake form. It's very general for the supplier. I found that a lot of the questions did not pertain to us. I did a face-to-face Medicare presentation like this in Florida, and they asked me to specifically make one for Foot Solutions, which I did. So just keep in mind that I created this one using CMS, thinking about the policy articles and LCDs in place. You don't have to use it. If you want to make your own, go right ahead. So anyway, so let's take a look at this. This form, and at my conference last week, they couldn't stress enough the importance of using an intake form. The reason why is because you are going to see very clearly if you have all the documentation in place to be able to bill Medicare and to be compliant and to be able to append that modifier KX, as we mentioned. So at the top of the form, we just talk about if the order was actually called in, because sometimes these could be verbal orders. But of course, we never want to bill Medicare until we have a written order in hand. We've got a beneficiary information section below. So we make sure that we have all of their name, number, Medicare number, etc. We also want to make sure that we are photocopying. This is a business practice, and I think a darn good one. Even the physicians are doing this in their own practice. You know that since you go to your doc. They take a copy of your driver's license. They take a copy of your primary and secondary insurance cards, so they can keep those on file, and I think you should too. Within the second section of beneficiary information, there is a line here that says which jurisdiction is that beneficiary from. As we mentioned earlier, it's very important to keep that in mind and to know who to bill. Then we have this next section called ordering physician information. This way, it's very specific. You can be as specific as you want or not, but I think it's important to really understand that the question asked here is the prescription within 12 months prior to delivery? This just keeps these really important questions at the forefront of your mind. Was a written order received if this was a verbal order initially? Are the billable items separately listed on the written order? If you go through an audit, that's very important. This is one component they're going to look at. Was it signed by the treating physician meeting the CMS signature requirements? The signature requirements, and it's actually something more we're going to go into during Part 2 of this workshop series, but they're requiring to be able to read the physician's signature. If they can't read it, then their name must be printed out next to it or near it. They clearly understand who that is, and your payment could be held up if that's not clear enough. But you can easily appeal and appeal that claim with a submission of attestation from the physician. Certifying physician section. So that's an MD or DO only. We have a section here with their name, telephone number. Make sure you gather the MPI, of course. So here we understand. The first question is the client being treated for their diabetic condition by this doctor? Yes or no? We want it to be yes, of course. Is the SCP, Statement of Certifying Physician, is the SCP completed, signed, and dated by the certifying physician meeting the CMS signature requirements? Yes or no? Crazily enough, oddly enough, yes, I said signed and dated. Completed, signed, and dated. And all the LCDs for all the jurisdictions, they ask that, or requiring that the physician complete, sign, and date. And I know that's not happening, so you might want to really take a real clear look about how we want to get that done. Is the SCP dated within 3 months prior to delivery of the items? Yes or no? Is the certifying physician an MD or DO? Yes or no? Of course, we want those to be yes. Did their clinical visit occur within 6 months prior to delivery? We want that to be yes, of course. We want to mark the date so we're real clear. Are you requesting the medical records prior to delivery to confirm they reflect the SCP? Now, this is entirely a business decision of yours. This is not a requirement by Medicare or by your jurisdictions to gather those medical documents or records up front. I want to really stress that. And we'll go into discussing whether we should or shouldn't in a few slides and let you make that decision. If yes, what date was the medical records received? Do they reflect the SCP? Do they reflect that Statement of Certifying Physician? I can't stress enough that they must mirror, the medical records must mirror the SCP that you receive. If no, what are you doing to, if no, what are you doing to rectify the situation? Meaning, are you reaching back out to your physician, the certifying physician, and letting them know, this is of course prior to dispensement of the items, are you letting them know that this does not satisfy? Are you empowering your client? If for some reason the physician's not listening to you, are you empowering your client and letting them know that they need to reach out to their physician? Perhaps they need to have a new in-person evaluation. Sometimes it comes down to that. And I want you to remember, too, I've had a lot of franchisees just groan and moan and just really upset about this component. And it is tough because these physicians are referrals or a referring source. But everyone is being audited in our industry. It's no matter of time of if, it's just a matter of when we're audited or have a prepayment review. And so everyone who is dispensing shoes, inserts, are going to be asked for this information, whether it's a podiatrist who is working with a certifying physician. He too or she too must see that their medical notes reflect this. So everyone's going to be asking these physicians the same question. It's just right now it's tough because we're all trying to educate these guys, and the onus is falling on the supplier. All right. The next section is questions for the beneficiary. Have you received diabetic shoes or inserts from another supplier or physician in the past? Very important to understand. This could be in the past 3 years ago. This could be in the past 4 years ago. Personally, I would want to know if they've seen my competitor or not, or who. Then next very important question, was it this year? Are they coming to you in June when they've already received their diabetic shoe wear in January? So you need to make sure you ask that question and verify through the IVR of your jurisdiction and making sure that they have not met the benefit. If yes for this year, which did you receive? Shoes, inserts, or both? There are times when the beneficiary is only receiving inserts. They might be coming to you for shoes. I've actually heard from franchisees that we are getting referrals from physicians who have already supplied inserts and who are now looking for us to supply the shoes. So this is a question that we want to talk about in a little bit. Remind me if I forget if we can do that or not. Who was it purchased from? So we want to know. If the inserts were purchased from someone else, we want to know who, right? Because we want to make sure that what their documentation says in their own notes and how we are billing them. Because maybe in this case, we need to have our beneficiary sign an ABN. Was the item returned? This is important to know if the item was returned. If a pair of shoes, if there's a problem with a pair of shoes, the written order, I said the written order is good for 12 months. Well, the written order is good for 12 months for any inserts or modifications that have to perhaps be redone or new ones given again, that sort of thing. But for the shoes, you must have a new written order for every new pair of shoes, diabetic shoes that you dispense again. Now, keep in mind, if the beneficiary comes back to you and says, hey, I don't like this black pair, I really want the brown pair, it's the same manufacturer, it's the same style shoe, you don't have to do that. But if it's a completely different type of diabetic footwear, from PW Minor to a Pedors, for example, you need to have a new written order. Okay? If the shoes are being replaced, was the new doctor's written order received? Describe the condition for the previous need. Perhaps there was actually a need, a change in condition. Perhaps they were supplied an over-the-counter diabetic shoe, and now they're needing a custom. In that case, it would suffice as long as you have the documentation to back that up. Okay. Are you enrolled in Medicare HMO? Some of us are only Part B accepting that, and some of us, meaning franchisees, are not in network with Medicare Part B insurers. So we want to make sure if we are not, that we're collecting the monies up front. If we are, you know what to do. Is Medicare Part B your primary or secondary? You need to understand that. And that's going to be how you collect your money, if it's secondary or not. Another question for the beneficiary. When did you last visit the certifying physician? Are they treating you for the diabetic condition? And then I'm repeating myself here on this section here, but I think it's important enough to do that. Did you sign the authorization form? Of course, you're not giving this to your beneficiary to fill out, but instead you're asking the questions yourself. Were the suppliers, page 2, were the supplier standards disclosed? Yes or no? Do you have proof of that within your client's file, that they did sign that supplier standards? I've seen other franchisees that they just make a photocopy of the supplier standards that was signed at the bottom or initialed at the bottom by the beneficiary, and that's proof enough. Questions for the podorthist to keep in mind. Did I photocopy the Medicare card, driver's license, other insurance card? Yes or no? Do I have a detailed written order? Yes or no? Do I have supporting documentation on file to meet medical necessity that reflects the SCP? Yes or no. Should I obtain an ABN? Yes or no. I'm going to go over an ABN a little later if we have time. If not, that'll be part 2. Are deluxe features requested? Yes or no. We know that deluxe features, A5508 is HCPCS code, are not a covered code by CMS. If that's the case, an ABN must be signed. I know I've had a franchisee call me and say that they had a client that really wanted this pair of boots and not those particular diabetic shoes. You know what? Instead of turning them away, have them sign an ABN, have them pay the difference between the two, understanding that that difference will not be paid. And again, there's a very specific way we would fill out the ABN. We need to go over together because you want to make sure that you're covered, and you'll be just fine. That would completely suffice. If yes, did you have the beneficiary sign an ABN to cover the portion not covered? Did you complete the in-person evaluation prior to or at the time of selection of items? Yes or no. At the time of delivery, did you document an in-person visit? Yes or no. And the last one, did you document the assessment of the shoes inserts with the beneficiary wearing them? Yes or no. Okay, that's the intake form, and that I think is extremely detailed. And when we talk about you have a compliant medical file, if you have all of these questions answered, you are going to have a compliant medical file. You are going to attain you're going to attain the SCP and have them mirror the medical records. You are going to attain a written order. You are going to have your detailed in-person evaluation as well as in-person delivery. Some of you guys are collecting medical records up front prior to dispensement. Again, this is a business decision only, not required by Medicare at this time. Let's take a look real quick at the form I gave you guys for the SCP and the written order. It is one form. It is two distinct different forms. SCP is one form. Written order is another form. I've had franchisees ask me, hey, it's the same guy. Why do I have to have him sign it twice? He thinks I'm crazy. Crazy or not, these are two distinctly different forms, and that same physician, if he's doing the order as well as SCP, he needs to sign both. I've highlighted the sections within both so you know which parts are very important for you to have completed for it to be compliant. Okay? Maintain these records for 7 years. Extremely important. All right. Comprehensive pelvic foot evaluation. We've got, this is a particular form. I think it's awesome. It really includes the patient history, the current footwear assessments you're doing, the palpation inspection, the gait analysis that you do, the foot and gait analysis, the foot measurement. And if you see underneath that, it says evaluation notes of customer wearing inserts. So in any type of recommendations, plan of care that you have, education, the scheduled follow-up date that you have with them, everything is on one form that you are required to have for your documentation. Next form, proof of delivery at the top. Clearly it says here you want to have your patient name, the manufacturing brand, size, quantity, the allowable listed. You want to go to PDAC, like I said, and make sure these things are reviewed. Assignment of benefits and return policy is listed here on one form. Next one is the patient instructions for the use of footwear and inserts. This is a great form that you just make a photocopy of, give one to your client, keep one in your file. The new shoes inserts break-in period, explanation. This is a great place here to show that you have scheduled follow-up appointments. Very important, and have your patient sign off on it. Patient records release authorization. We are not required, really and truly, to have our patients sign a release form. If we ask for medical records from the referring physician, they are required. We are a healthcare provider as well, and they should give them to us. I know that there are a number of franchisees out there who have had a hard time receiving that info. The physicians are used to receiving the physicians are really used to receiving other records release authorization forms from other colleagues, from other physicians. This is something in their mind that they're used to, even though it's not required, and we should be able to get it afterwards. This is just going to help you keep within your time frames if you have one, if you're being audited or whatever, or just for, lessen the pulling out hair thing, that we all have in trying to get these records. So this is something that you can use. Also has notice of privacy practices at the bottom. Also, here's a nice list of the supplier standards. Make sure you have them initialed at the bottom. Make a copy of it for your documentation. Also, within the supplier standards, it does ask that we have our clients take a short survey. Some franchisees out there are sending the survey out to their clients and for them to receive it in the mail, and some of them just give it to them and ask them to mail it in. You want to make sure that you document and say that you have asked them to do that. Okay. And then the last one here is last form here. It's not required. This is something that you can use if you'd like. I liked it because it says that so-and-so client, for example, has declined to purchase a diabetic therapeutic multi-intensity inserts, and they can refuse it. They're allowed to refuse it if they do want. You can't force them to take it. All right, so we've got a couple of guys here that I've heard about that have had problems obtaining medical records. I think it's just really important to go through that. On the InfoNet, I'm going to have a fax cover sheet that you can use. So that way, if you're making the phone call or if you're faxing that referring physician for the medical records, you want to make sure that you are super clear as to what you need those records to have within. I've heard of I've spoken to a few franchisees who've said they have received 21 pages of notes, and not one page of that note talks about the foot. So we want to be really clear with the doctor that we need a diagnosis of diabetes on that, we need a complete office note, and we need documentation on the foot conditions. And then giving them a copy of the SCP that they signed off on is going to show that they need to have that mirroring that. And you're going to be speaking with the nurse in this case, because it's going to be the nurse that more than likely is going to be pulling this documentation for you and making sure that you have everything that you provided. This is going to be your best friend. If you are asking for these doctor's notes due to an audit or prepayment review, make sure you submit, in fact, a copy of that audit showing them that. If not, just letting them know that you need it for your records should be sufficient. All right, so when you're following up and asking, say, hey, did you get my fax? Or I've waited now for 24 hours or 48 hours. Of course, we're very nice. We're speaking with the nurse or the billing management department. We're not speaking to the doctor. We want to stress the time frames that we have. So if it's an audit or prepayment review, we have 30 days, 45 days to get this back to CMS. We want to make sure that they understand that we are on a tight timeline. If the notes are not received, get your client involved. Empower your patient, your client. They will help you. Okay, medical records, are they complete? This is just again, to review the same medical records and what they need to look like. Again, if you're unsure, have Dr. Bill assist you in reading those medical records. I'm going to fly through a little bit here because I want to make sure we get to all Q&As. What recourse do I have if the medical records are incomplete? I'm speaking with Cigna, and I have a great contact within Cigna on the CGS side. And I think this is a very important slide, enough for all of us just to read and see clearly. When I asked this question, he told me, this is a really tough question, and we hear it often. The unfortunate issue is that your NPI is on the claim, and it is your business that will suffer in an unfavorable audit situation because we, the supplier, we take, the onus is on us, right? For years, physicians have basically said, here's a prescription, don't bother me. That has now changed as physicians are getting audited from cert contractors, just like you are, all right? You don't have to accept the referral from the physician, but you want to continue and grow your business and increase your customer base. Thus, you're caught in the middle. Some companies have brought goodies and information to physicians' offices explaining the need for the partnership so that way they're able to educate that physician on their needs. If you simply cannot get the medical records, it is up to you to accept the referral and supply the patient with the item in question. So in an audit situation, then, you may not have the documentation required to back up the claim. So in essence, the choice is yours. So if you're not, so this is, when I talked about the medical records being a business decision for you, for whether you should collect them up front prior to dispensement of the footwear or not, you'll have to make the determination if it's worth it to you or not. Personally, I think it is, but it will be up to you. This is just a documentation timeline of everything we've just gone over. And I think very important to keep in mind, the visit with the certifying physician, the MD or the DO, as we said, it must be within 6 months prior to delivery. The visit to document with the qualifying the foot condition, it must all be within 6 months prior to delivery. Again, the completed SCP must be signed within 3 months prior to delivery, signed on or after the date of visit. The written order by the prescribing physician can be after the visit. So, and also the prescribing physician might not always be the certifying physician, right? So in this case, it could be that. So when they come to see you, and I put 2 separate selection visit and delivery visit because sometimes that does happen, that they're separate. The selection visit, you just want to make sure that you are evaluating and documenting. And of course, the claim submission that you do after all of the above is received. You want to make sure that you've received that written order prior to billing. You want to make sure you received the SCP prior to billing. And you make the determination whether or not you want to receive those medical records and they mirror the SCP. Okay? All right. It's 9:40. I've got the ABN here. Thinking about not going over it for this one and maybe transferring it to the next. We have 20 minutes before the end of our class. I'd like to take all these questions. Here. And instead, if that's okay with you, and if we have time, I'll go through the ABN. If not, I'll just transfer them over to to Part 2. And our next class will be the 13th of April. Let me just go to this one more thing here. Documentation checklist or intake form. There's a documentation checklist for jurisdictions C and D. Again, I'll make sure that those are on the Infonet. The documentation checklist for C by Cigna is extremely detailed. I have gone over that with a fine-tooth comb, and I haven't found one thing, personally, that is not within the other jurisdictions' policy articles and LCDs. So if you would like to use their checklist, I think it's probably great. So meaning if you want to do a self-audit and make sure that your files are in order, go ahead and do that. If not, using this intake form on the front end that I've prepared for you, great tool. If you'd rather make your own, again, it's not required. If you'd rather make your own, go ahead. I'm happy to look over any documentation that you have and assist you in any way. We'll run through the updated requirement. I don't think it's going to be anything new for anyone, perhaps not. But because the effective date was last week on this, I felt it was important just to bring it up. It's actually the enrollment or revalidation or re-enrollment. When you re-enroll, and we do that every 3 years with our National Supplier Clearinghouse, the 855S, they're not calling it re-enrolling anymore. For whatever reason, they're calling it revalidation. We need to register on PCOS. We have only 30 days to respond. There's only a one-time 60-day extension. Within the packet that I gave you guys on Wednesday, I did include the MLN matters, so you can see in detail everything that it speaks to. What is important for you? Why am I even bringing this up? Well, now they're having 3 levels of categoric screening, limited, moderate, or high. I've highlighted moderate or high because that is actually what applies to us. They also have an application fee, and they also may impose a moratorium or a freeze on the enrollment of new suppliers or the establishment of new locations. I haven't heard of any moratoriums yet. That's actually told to us by the Federal Register. So I haven't heard anything yet on that. So we talk about categorical screening. Who receives the moderate? If you are already a DME POS supplier and you have to revalidate and re-enroll, revalidate, your 3 years are coming up, you're going to receive a letter from the National Supplier Clearinghouse, letting them, them telling you. So you have 30 days to complete that, and you're going to have a site visit prior to them making a final decision if they are going to revalidate you. The high-level screening, those are for all newly enrolling DME POS suppliers. So, again, everyone has to have an on-site visit prior to them making a final decision whether or not to bring you in the network or not. Also, there could be a possible delay or moratorium, and again, that depends on the Federal Register announcements, and there hasn't been any yet. All right, I'm going to take everyone off of mute. So if you wouldn't mind, go ahead and muting your phone so that way there's not a lot of white noise in the background. I'm going to answer.
The conference has been unmuted.
I'm going to start up at the top, and I'm going to answer the questions. And, of course, if you guys have any other questions, please feel free to ask. And if I don't know the answer, I will research it and get back to you today, if possible. All right, let's see here. The first question is, you said Texas is a licensed state. As far as I know, it's not. Sorry, Barry, let me just look real quick on my form. It's listed. I apologize.
Stephanie, it's Sherry.
Hey, Sherry.
Good morning. I'll answer that question for you.
Yeah, go ahead.
Texas has OMP licensure. Remember, Podorthix follows under OMP licensure. In the state of Texas, the licensure laws that they have on record do not include any specific additional requirements for Podorthix. So that's what that means. There's OMP licensure for the state of Texas, but there is no additional restrictions or additional regulations for certified Podorthix practicing Podorthix services in Texas.
Thanks, Sherry. Barry, does that explain clearly?
That's fine as long as I don't have to. I'm not licensed. I mean, I don't fall under that. Does that make sense?
That does make sense. And as a certified Podorthix in the state of Texas, you are practicing within your scope. There is no additional licensure required for a Podorthix.
Okay.
Okay. Thank you, Sherry. Thanks, Barry.
You're welcome.
Next question. Please explain how the written order is good for 12 months when you only have 90 days to dispense the order. Okay, well, that's a great question, and it is odd, I know, but the 90 days has to do, again, the 3 months really has to do with the statement of certifying physician, and that is what's good for 3 months. Remember you said that we were going over the intake form, and I spoke to the inserts and the modifications, and sometimes, maybe the insert went bad, or something's wrong, or it needs to be replaced, or they lost it, I don't know, something like that. You guys can do that with the written order itself, the old written order, or the one, as long as it's within a 12-month time frame. So that is how a written order is good for 12 months. If you remember, if there is a shoe need, you have to get a new order, a new written order. Is that clear? Okay. Next one. Doctor writes written order for shoe modification. Yeah, that's why it needs to be clear. And, if we go back and take a look at that slide, describing who the prescribing physician is, we said that they must have a knowledge of footwear. Therefore, they must know what they're prescribing, if that person needs modification or not. if you see that they need a modification and it's not on the written order, for example, I would reach back out to that prescribing physician and discuss the patient with them. You are an allied healthcare professional, and it is with that physician, a colleague, that physician, I'm sure, would deem it necessary and certainly within your right and appreciate your contact with them to discuss. Next question. Can we choose to deliver custom molded shoes as non-assigned? If we do, no. Okay, the question is, can we choose to deliver custom molded shoes as non-assigned if we do assigned for everything else? I'm going to assume that this franchisee is telling me that they are a preferred provider. They are a preferred provider of CMS, and therefore accepting assignment of delivery, accepting assignment of claims. So what I would say here is that no, you may not pick and choose which item that you can accept assignment on. It would be great. It would be a great thing to be able to pick and choose. But no, you cannot do that. All right. Oh, okay. They just sent me another thing. Said American Shoe advised us years ago to bill as non-assigned. You know what? I'm going to take that offline. I'm going to talk to American Shoe, and I'm going to talk to my contacts, and I'm going to give you a written determination on that, guys. Okay? I'm going to follow up with you on that. But I would definitely say no. Next one. Could we have the SRN send PDAC letters for their Prodors and other product they supply to all stores? Yeah. Could we have Shoe Renew send PDAC letters for the Prodors? What we'll do is I'll work on pulling that for you. Okay. Could we get an electronic editable version of your intake form? Absolutely. That's actually going to be on the Infonet. You guys are going to have all the documents, all documents that are editable on the Infonet this afternoon. And I will send it. We'll send out an email letting you know exactly where they are. I just say no, it's going to be under the Foot Solutions library, underneath the Medicare file, and within that it's going to be our April 1st workshop Part 1 series. That's where they'll be. Let's see. Sorry, let me go through. All right. Should there be a new slide? Sorry, I don't know what that means. I don't know what that question means. Did you want to send me another one or ask outright? You can explain. I'm happy to hear you. Are we on a build? Okay, I guess this came in the middle. It's not really a question. All right, skipping along. What about L5000 code? Can we make an ANTHET and bill Medicare? Well, again, looking at your 855S application, you more than likely have said that you are a diabetic supplier of shoes. So, no, you cannot use the L5000. You could bill it if you are non-assigned.
Stephanie?
Yeah, go ahead.
L5000 is a toe filler. And an L5000 can go on an A5513.
Oh, as a modification?
As an addition, yeah, as an addition to that. So yes, they can do L5000s.
Okay, thank you, Sherry. My apologies.
You're welcome. If anybody's doing L5000s and wants to learn how to bill for L5000s, please give me a call and I'll tell you exactly how to do that.
Okay. All right, perfect. Let's see. Getting medical records up front. What do you do in Wendy Hill Store? Wendy Hill Store, we get the medical records up front. Okay, so next question is, suppliers must re-enroll every 3 years, please address. This has to do with the revalidation of the CMS 3028FC, what we were just talking about, the 855S. They're going to be sending you a letter your National Supplier Clearinghouse when it's time for you to revalidate. Everyone will receive one. You might receive one a couple of months early or within your time frame. So just take a look at your 855S application and see when you last applied, and then you'll know when your renewal or revalidation is coming up. Okay, I haven't re-enrolled. Am I in trouble? I tell you what, why don't you just give me a call after this and we'll talk through it, okay? So we'll just talk specifically to you. All right. Are the standards for Medicare Advantage insurance company the same as Medicare? I know that, for example, the marketing standards are much more stringent than Medicare. I know that. So that's different because it's more stringent. But the allowables are usually the same. You want to tell me a little more about what you mean by standards? You mean supplier standards here? And if you're talking about supplier standards, I would say absolutely yes, they are the same, because we all of us need to follow the supplier standards. Okay, next question. Sherry, are you still on?
Yes, I am.
And you're going to have to answer this one. Could you please provide a progress update on certifying the SheRenew lab?
Yes. I'm actually going to have something posted by the end of April to let you know about certifying the lab. You technically don't certify a lab. You certify the products that they produce, okay? So certification actually comes down on the products, and those are products that you submit into PDEC, which is pricing, data, analysis, and coding. And basically what you do is you send in the raw goods, and you send in the policies, the procedures, and the compliance standards that you have to produce products, and then you send in the end product, meaning the finished product, and the doctors and the nurses sit in a room, they touch and feel the product, they go through the process, and they actually say, yes, this product meets A5513 code. Okay, so we are currently doing that, and I'll have more information for you by the end of April, okay, on exactly what products will be what we call certified or reviewed under PDEC, and what standards and coding that they actually meet, and then what your pricing category would be, meaning what you acquire that product for. So I will have an update for you. We're very near to making that happen.
Great. Thanks, Sherry.
You're welcome.
Okay, next question is, Standard 29 said something about not mixing suppliers. What about DPM or pharmacists also doing therapeutic shoe bill? Well, the question is that is the podiatrist and the pharmacist in the same store, the same room, more or less, and do they each have a different NPI? That's the question. If they don't, then it's different. But if they have a different NPI, that's where the concern comes, and they have to have, and that means they would have to have a different suite and have to be extremely clear, that one is one business and another is another business. And the ombudsman from the National Clearinghouse told me that they would prefer, well, not even, let me remove that word, not prefer, that they must have, the U.S. Postal Service must have two different suite addresses for them in that case. Next question, required, only DPM. You know what, why don't you give me a call afterwards and we can talk about that in a little more detail, and then I can write something up for the whole group on that. Okay. Okay, next question. Required to not collect the Medicare 80%, but we can always require the 20% regardless of supplemental carrier. Absolutely, yes. You know what, there have been cases where the supplemental or the secondary is actually sending the 20% check to the client, and you know, and here we're expecting the client or the insurance company to send us the check, and they send it to the client. And then I know there have been times we've had franchisees who are having a hard time collecting that 20% then from their clients, strangely enough. So if you want to go ahead and collect that 20%, And then, up front, you can do that always. And then if you receive a check, of course, from the secondary, then, of course, you reimburse your client if you receive the check. So that was fine. Okay, we have 5 more minutes left until the end of the meeting. I'm going to take everybody who was on the call today on the web. I'll have a list of their names. If you were, for some reason, not able to log into the webinar itself on your computer, but had to listen to it on the phone, I won't get your name. So you want to email that to me, let me know that you did attend, and I will then send you the quiz for you to complete. If you could then send it back to me, the answers, Betty's going to go over that and let you know if you've made an 80% or higher. If you did, then you will receive your 2 CEU credits for this class. We have 4 more minutes. Any other questions? Okay, the next section, Part 2 workshop of our Medicare relaunch will be April 13th, which is a Wednesday, so a week after next. And you can see what the agenda looks like for now. We didn't have a chance to go over using an ABN, so that will be added to the agenda for next week. Thank you so much. Have a great day.
Thank you.
If you have any questions, don't hesitate to call.
Thank you. Please stand by.